There are some drugs that causes thrombocytopenia like heparin, sulfonamides, some cephalosporins, linezolid. These drugs causes low platelet count by different mechanism. For example, linezolid suppresses bone marrow production of platelets. Some causes platelet destruction, but heparin causes platelet activation. Immune mediated platelet activation. Heparin molecule has a distinct mechanism of action that I would like to talk with you today. When you administer heparin in the circulation, heparin binds to antithrombin 3, and antithrombin 3 then inactivates other clotting factors. In addition to binding antithrombin 3, this heparin molecule also binds to platelet factor 4, which is released from platelets. So platelets release variety of protein molecules. One of them is platelet factor 4, others are serotonin, right? So heparin binds to platelet factor 4. This is normal. In anyone, if you give heparin, it will bind to platelet factor 4 and antithrombin 3. This is how it inhibits clotting. But in some patients, antibody forms against the immune complex of platelet factor 4 and heparin. So there is complex of platelet factor 4 and heparin, and antibody forms against that complex, heparin and platelet factor 4, and that antibody starts activating platelet. So when platelet activates, they release more platelet factor 4, more serotonin, then other platelets also come to nearby, and platelet aggregation occurs. So when platelet aggregation occurs, there is consumptive decrease in number of platelets because thrombosis occurs, and that leads to low platelet in the circulation, right? So you can call this consumptive coagulopathy because platelets are aggregating and making thrombus, and their platelets is getting consumed, and thus in the circulation you see low platelet number. Even there is low platelet number, rather than bleeding, there are thrombosis in skin, other sides of the body. Why there is not bleeding? Because platelet is not even that much low to cause bleeding. Generally in heparin induced thrombocytopenia, platelet count is more than 20,000. I have never seen any patients with heat with platelet count less than 20,000. Why platelet does not fall less than 20,000? Can we guess? Because it is not destructive inflammation, it is not destruction, this is activation of platelets. So when there is consumption of platelet, in response to that, bone marrow produces more platelets, and that maintains platelet count more than 20,000. So generally we see platelet count more than 30,000. It does not fall too low. And this immune mediated mechanism occurs like between 5 to 10 days of initiation of heparin. Why it take about 5 to 10 days? Because when you give heparin first time to a person, then antibody forms but it takes some time. It might take like 5 days, 7 days. But once patient receives heparin in future, after 3 year, 4 year, whatever, if he again receives heparin, there is already memory B cells, so that instantly produces antibody. So second time reaction will be a lot faster, even on the same day. But when a person has never received heparin in his lifetime and he is receiving first time, in that case the formation of antibody takes about 5 to 10 days. That's why if you have seen 40 score, if platelet count falls between 5 and 10 days, they give 2 points. But if less than that and more than that, they give less point. Similarly, in the 40 score, if you see platelet count more than, if it is more than 20,000, they give 2 points. But if it is less than that, less than 10,000, they give 0 point or 1 point. I exactly do not remember, but platelet count more than 20,000, they give 2 point. So that is the rationale why this 40 score gives more point to those parameters. And in 40 score, in addition to these two, there is also third point, that there should be no other causes of thrombocytopenia, like patient might have DIC, disseminated intravascular coagulation, or might be in sepsis that is causing thrombocytopenia. So those should be ruled out before labeling it. And fourth point is, there is thrombosis. So if you are seeing some evidence of thrombosis, either skin necrosis with thrombosis or other thrombosis elsewhere, deep vein thrombosis, renal vein thrombosis. So if there are thrombosis, then also you give some point in 40 score. So this is about heparin induced thrombocytopenia, that is immune mediated. So when it is immune mediated, we call it type 2. But when it is not immune mediated, then we call it type 1 HIT, heparin induced thrombocytopenia. Like you all might have seen HIT type 1, like when we administered heparin, the next day we see slightly low platelet count, but it is not even less than 100,000, it is more than 100,000. And that is not clinically significant. If you continue heparin, platelet again starts rising, because it is not immune mediated platelet activation, right? So that's why it is a benign condition. That's why we call it HIT type 1. Even you don't need to check serotonin or platelet factor 4 to confirm HIT type 1, because it is clinically obvious. There is slight decrease in platelet count, even less than 30%, and if you continue to monitor, it starts resolving. But if it is HIT type 2, then you will see gradually decreasing platelet count, and in between 5 and 10 days there is sharp fall in platelet count. That's why we differentiate whether it is immune mediated or this is non-immune mediated benign condition. When you diagnose HIT type 2 with 40 score, then you also do serotonin release assay, because activated platelet release serotonin, platelet factor 4. So with these lab parameters we also can confirm HIT type 2. And when you get confirmed that it is HIT type 2, then stop heparin, because it will aggravate it. So stop heparin and change to some anticoagulant that does not cause that immune mediated platelet activation. Simple, like argatroban, fendaparinox. They have less propensity to cause immune mediated platelet activation. If you compare unfractionated heparin and low molecular weight heparin, obviously low molecular weight heparin, it because it is only a shorter part of heparin, unfractionated heparin, it has less propensity to cause heparin induced thrombocytopenia.